Bradley.
I'm Brad. I was where you guys were last year, and this is painfully boring. I know that, so we'll be quick. I'm not as charismatic as Jason or smart as Todd, but we'll figure it out. There will be things covered here that are on the test, and I'll talk in a really annoying voice if they are on the test. So, HIPAA, Health Information Portability and Availability Act. That is what HIPAA is. It is a federal law passed in 2003. Next slide, please. HIPAA covered entities, healthcare providers who transmit any health information electronically, cell phones, in connection with certain transactions. So this came about because when STAR began, it was just kind of like a hodgepodge of people who weren't really medically trained or anything yet. So we're taking on more of a medical role and stuff, so that's why this is becoming relevant. Next slide, please. Who is a healthcare provider? Any person or organization who furnishes bills or is paid for healthcare in the normal course of business. That is not us, except for the EMTs.
We don't bill.
And we don't bill. Nobody bills.
If they load it into an ambulance, then they get a bill, but we don't bill.
Yes. General first aiders, which is all of us, are not covered by HIPAA. There's a lot of caveats. Are all healthcare providers covered? Healthcare providers are covered only if they transmit health information electronically in connection with a transaction covered by the HIPAA transaction rule. So EMTs are becoming required to keep electronic patient records, so that's why this is relevant here. Is SAR covered under HIPAA? While SAR can be considered a healthcare provider while performing EMS duties, it is not governed under HIPAA so long as there are no electronic records or transactions. However, EMS and the hospitals they transport patients to are covered entities, and SAR should still follow practices for patient privacy. PHI. PHI is protected health information. PHI. Individually identifiable health information. That is what PHI is. It is transmitted or maintained in any form or medium by a covered entity or its business associate. Individually identifiable health information. What that is health information, including demographic information, relates to an individual's physical or mental health or the provision of or payment for health care. It identifies the individual is what it comes down to.
Name, date of birth,
Yep.
security,
De-identification of PHI, how to get rid of that information or just not use it at all. Removal of certain identifiers so that the individual who is the subject of the PHI may no longer be identified. Application of statistical method or stripping of listed identifiers such as names, geographic subdivisions, all elements of dates, social security numbers. General rule. Covered entity may not use or disclose PHI except as permitted or required by privacy rule, except to EMTs or higher or lateral care. That's when you would communicate that. We could skip that one. Treatment. Treatment means the provision, coordination, or management of health care by first responders or healthcare providers, including consultation between first responders, healthcare providers for direct patient care, or patient transfer between providers. Next slide, please. Limited data set. This is a fancy way of saying it's used for statistical purposes. For research, public health, healthcare operations purposes, direct identifiers must be removed, allows zip codes and dates, requires data use agreement, recipient cannot use for other purposes or identify or contact individuals. Again, the PHI is all removed. That would be used like if they want to keep track of just certain random statistics like which type of medical treatment worked better for a situation, or maybe a gender demographic for people who get injured out there the most or something like that. So the minimum necessary PHI you want to use is covered entities must make reasonable efforts to limit the use or disclosure of and request for PHI to minimum amount necessary to accomplish the intended purpose. In summary, this is the test. Health Information Portability and Availability Act, that is HIPAA. SAR is not a HIPAA-covered entity, but should follow patient privacy practices. SAR should only disclose or share PHI as needed for direct patient care or transfers, and outside of direct patient care or transfers, only de-identified information should be shared as necessary. So this also includes like over the radio, even talking amongst the team and stuff like that. You don't use the patient's name. You just call them the subject, patient. You don't pass any of that information even amongst us over the radio at any point. Clear as mud? Eileen, yes.
One other thing, when you go home, you don't discuss the patient with your family. You don't say, oh yeah, we had Lily, she was 6 years old, she had this wrong, that wrong, Hitman. You don't discuss that with family. That's private patient information, we don't pass it around, okay? They have the right to their privacy. We don't tell people how they were injured, what their problem was when we found them, we just don't discuss it.
And your family and coworkers will work you and work you and work you trying to get that information out of you because they want to know. They can't help it. Guys at work still, after 12 years, they still keep working me, and I won't tell them.
Yeah, gee, Todd, why are you only here 3 days a week?
So.
Or worse yet, the media.
Yeah.
Yes, oh, yes.
Yeah. Any questions, concerns, comments?
Our patients, our subjects.
Todd, anything to add?
Not really.
Okay. Okay. That's the test, though. That's the test. Test.